This time last year, I was so foggy-brained I didn't even know what we were celebrating.
There wasn't a lot of joy in Jackie Schroed's life just 2 years ago. Determined to see her great-grandchildren become adults, yet unable to complete the simplest task.
I would be changing the linens on my bed. I'd have to sit down twice before I finished. I was very short of breath. Well, on May 15th, at 2 o'clock in the morning, I awakened with terrible, terrible chest pain. Something had to be done.
Something to correct aortic stenosis, where the aortic valve does not open and close properly, forcing her heart to work harder. A decade earlier, her twin sister underwent open heart surgery for the same diagnosis.
At that time, we didn't have the procedure that we have today. She was 15 days in the hospital and very convalescent for quite some time at home.
Just 10 years ago.
10 years ago.
Baylor Scott and White Heart and Vascular Hospital Fort Worth are at the forefront of a less invasive procedure called a transcatheter aortic valve replacement, or TAVR.
But thanks to this very important advance in technology, we can now, in a relatively straightforward procedure, through a single arterial stick in the groin, advance this specialized valve through catheters and deploy it over a patient's diseased valve that's causing all these symptoms, and really significantly improve their quality of life, extend their life, ameliorate their symptoms, and really get them to feeling much better.
This is what the valve looks like. I only was inpatient for 39 hours. My twin sister came the next day. I opened my door and greeted her, and she nearly fell out.
A comprehensive cardiac rehabilitation program followed, strengthening Jackie's heart and providing the confidence to accomplish her goals.
Once we change the anatomy of a patient's heart, we really want to make sure that exercise happens in a very staged, programmed setting with experienced cardiac nurses observing a patient on telemetry, on EKGs. It's a tried and true measure with absolutely 5-star outcomes for patients.
It is quite a security blanket as far as I'm concerned. I know that that team is going to be there, and if something happens, they will take care of me.
And then it pumps again.
Look at you. The older you get, the more you cherish family. To get that second chance to be whole and healthy. The Baylor Scott and White Heart and Vascular Hospital is top of the line.